All right, back to the cardiology, our basic EKG. We're looking at our sinus rhythms. We should always have a P wave. There should be a QRS, and then there should be a T wave. Again, I wrote it up here for those that are not visual learners. There's a P wave. There is a PRI or PR interval where there's a pause or a space between the QRS complex and the P wave. Then we have the QRS complex and then the T wave. Again, the P wave signifies atrial depolarization. The PR interval signifies a short pause in that impulse at the AV node. The QRS signifies depolarization of the ventricles. We should feel a mechanical contraction. We should feel a pulse during this time. And then we have a T wave that signifies repolarization of the conduction system altogether. Some of the basic rules though, when we're looking at this, we need to see some consistency. Things have to be the same in order for it to be sinus. You need to always have a P wave. And it is always upright. It's small and round. You can tell it's not as big as the T wave. It's a smaller. And it has to be before every QRS complex. Has to be before. If you don't have these things where it's not in front of every complex, it's not before, it's a little bit further apart, it's moving around, or it's just not entirely there, or it changes in shape or form, then it's not a sinus rhythm. So these are definites. It has to be before, it should be round and upright, it's small and round, and it's before every QRS complex, and you know there's a small pause here. Very small though, very small. Not as dramatic as I drew it out here. So it's before every QRS complex. The PRI or the PR interval is where, again, we told you that the impulse is kind of slowed at the AV node. Again, this space should be very short. We shouldn't see something very dramatic on the EKG where this space is. You can, I really drew this comically large. But we would like to see this being very short. And you're going to say, how short? Well, sometimes it should be barely noticeable. If it's extremely noticeable, it's probably not short. So usually it's barely noticeable, but if you can tell, like, wow, that's pretty long PRI, then it's probably not going to be what we would say sinus rhythm, because this should be relatively short. And if it's a sinus rhythm, every QRS complex looks exactly the same. From the previous one to the one that came next, they're all the same. There should be a QRS complex for every P wave. They should be narrow. It should be very thin. Some of us, we've seen this on some of the generated EKGs. From the mannequin, it's a very narrow QRS complex. It should be nice and narrow. But I put down, or it could be wide, and you're saying, well, what is wide? Well, I'm going to dramatize this again. And all it did was, this space in between this QRS now is wide. You see how wide it is? And when you look at those EKG tracings, as we start to see them on real patients, you're going to notice that usually it's really fine. It's like two needle points that kind of went up and down. You know? But when you start to notice, I can see the separation between the two of those, then you would consider that, I wonder if that's wide. Now, does that matter? Not really. For this basic course, what we need to know is that there should always be a QRS. And I just wanted to let you know that it could be wide. So you're not like, oh, it doesn't look narrow, it's not sinus. Sinus rhythm can be narrow or wide, the QRS complex. But you must have a P wave. If it doesn't start this way, this is why we write it linearly, and this is why we draw it linearly, that if you don't have these things before it, you can't call it sinus. Right? You start off looking at the rule. I need to check to see if I have P waves first. I don't go on to see, oh, do I have a PR interval or QRS? You need to find the P wave first. And you go to the next criteria, and the next criteria, and then finally the last criteria. For you visual learners, that first upright, round shape, you should have a slight pause in between, then the next up and down, squiggly, very narrow type of line, and then a large hump at the end. is your T wave, representing your repolarization of the conduction system. Now there were some questions brought up yesterday that what's the ST segment? Well, the ST segment is right there between that QRST. That's that ST segment. It's between there. And we're going to kind of draw this in right now for the ST segment. Well, it has to be part of the S. Is that correct? So the S wave is what's supposed to be the negative deflection of the QRS complex. So this is part of that S wave as it comes up. And this is part of that T wave. So this is that ST segment, if you will. And some would probably go maybe up halfway, so it's half of the T wave shares the S wave. This is your ST segment. The only significance when we're looking at this ST segment for the basic EKG course is when we're looking for somebody that's having a STEMI. Doesn't necessarily have to be sinus rhythm to have a STEMI. You could have all different other types of generated rhythm from the heart. But in the case where it's sinus rhythm, you would have a what? P wave first. So I'll draw this P wave. We'd have a PR interval. We'd have a QRS complex. And then the ST segment, which is what we're looking for the heart attack, is that this thing kind of goes up. And it continues to stay up. And eventually this ST segment this is exaggerated again, but becomes more of this what they call a tombstone pattern. So that ST segment, and again, I guess I should draw this line to kind of marker in there, but the ST segment is that whole part, and we would usually start from right about here to there, and you can see it. It's starting to elevate. That's the point here, is that as it starts to move up, this is elevating above the baseline here. All of this is elevated now way above baseline, that ST segment. Where's baseline again, Dave? Well, it was that imaginary line that I told you you would draw where the P wave would go across QRS and T wave went across. So you would draw this imaginary line across your EKGs that you're looking at, and you would look, do I have an ST segment elevation? Well, that doesn't look that significant. It's not that big. Well, this is, nope, that's kind of downward. This one has none. And if you draw your baseline here, you'd say, oh, I got something here because that's elevated. And again, your baseline here, you go, okay, I got some elevation there. In fact, this whole ST segment is quite elevated as it's starting to go up. It's sharing that elevation. Luckily for us at the basic level, when we're putting it on our 12-lead EKG, a lot of this will have some interpretation. So it's important that when you press for the analyzing and acquiring your 12-lead EKG, that all the leads are on. The patient is sort of at the most still position that they can be. And that you want to make sure that you put in the age, sex, and then press and make sure that it's of that diagnostic quality for it to interpret this rhythm. But this would signify that STEMI or ST elevation MI. And here we use basically on all of our medical facilities, we would call ahead of time to alert them that we're coming in with this type of case so that they can prepare and be ready to receive this patient and give them the desired treatment. All right, so going back to reading the EKG, as we got the P wave before every QRS, there's a PRI if we have the P wave. Then we have a QRS, that can be narrow or wide. Again, we just know it has to be there. And then the T wave. And now if we see that all the time, redoing itself over and over and over, if it's between the rate of 60 and 100, we would call that sinus rhythm. And all these rules have to apply. If we have all these rules and they apply and the heart rate is 59 or less, sinus bradycardia. sinus bradycardia. And if the heart rate over here is 101 or more, and all the rules apply, we have sinus tachycardia. Sinus tachycardia. Okay, there is just one small little caveat I'd like to throw in so that you guys are aware of. When we start to see these strips go across and you see the EKG start to transition all the way across, I believe you'll be able to see this. So we got a P wave, QRS, a T wave, P wave, QRS, a T wave, P wave, QRS, and then a T wave. And you know what we're trying to do is make sure that from here to here, these QRSs, that they seem to be marching up. They're as regular as possible. There's not that much deviation in the way that they look and how far apart they are. In fact, we also try to measure out the P waves to see if the P waves march up. In some cases, we may have this a shorter, well, I didn't draw that as short as I should have. In some cases, they may be even a shorter short or earlier beat, because then we measure out this, the length between that complex and that complex, it's too short. It's not the same as the previous ones that are marked in green. It meaning that it came early, right? It fired early. There's an earlier beat. That's why this spacing in between it is shorter. It's an earlier beat. Again, let's look at these normal ones. There's a P, QRS, T, P, QRS, T, P, QRS, T. And we try to look at the spacing. They look to be as spaced out evenly as possible at a freehand drawing. And then here we have this blue QRS complex. That's when you look at the spacing, you compare it to these previous ones. The spacing it seems too short. It's not as long as it should be. And it's drawn in blue here, so it's signifying that it came early. And that's what I'm trying to represent, an early beat. An early beat is sometimes called premature. So a premature beat. We may see a lot of premature beats, but as long as this EKG rhythm goes back, it goes back to, you know, whatever is going on. You mostly have what's sinus rhythm with either a rare extra beat, or if they're more than 6 or 7 in a minute, then they're kind of frequent. But there's still a sinus rhythm, you just have some extra beats. And those are called premature beats. And we'll bring that up as we practice and we look over things. But more than likely, it's still sinus. As long as the rules apply.